if we could share my screen too. Perfect. Thanks so much. All right. So hi, everybody. I'm so happy to be a part of this event today. As Lisa said, my name is Sasha Kalcheff-Korn, and I am with Realm of Caring Foundation in Colorado Springs. So where the trip winner will get to go. It's beautiful here. So hopefully someone gets to win that. So at Realm of Caring, we do have, just like Lisa said in her introduction, we have ongoing cannabis research study with Johns Hopkins University, where we publish data on our findings. Currently, we have 3 published journal articles on quality of life, epilepsy, and mood disorders. And we also educate medical professionals, the cannabis industry, through media outlets, and then one-on-one with individuals worldwide through our free call center. And then lastly, we support our community by advocating for access, finding quality products at affordable prices, and creating connections. So I tried to gather as much research as we have available from not only our own published research, but from what other published research that that's available, that we report on a day-to-day basis with clients. So there's a lot to cover today. It's a little bit research dense, but hopefully, it all, makes sense. But if there's questions anybody has afterwards, of course, myself and my team are happy to answer those for you or discuss things in a little bit more detail. So first, we're going to talk about the recent research that has been published on the effects of cannabis and COVID. Then we're going to take a look at the enormous body of research that has and is accumulating for cannabis and cancer, as well as other diseases and disease states. So recently, there have been 2 papers that were published on the potential of certain cannabinoids and their effects on the COVID virus. So the first paper to come out was this one on CBDA, and the second one was on CBD. So we're going to take a quick look at those papers just to see what was discovered and then what discussions came out of them. So this research on CBDA explored if specific cannabinoids could be used to block the infection of the SARS virus. An approach known as MAGMAS was used to screen which hemp extracts may bind to the SARS spike protein. 2 cannabinoids that showed the highest affinity for the virus spike protein were CBDA and CBGA. They were both confirmed to block the original live virus and 2 variants of concern, which are alpha and beta. CBDA administered orally to human volunteers at a pretty low amount at 0.063 milligrams per kilogram showed greater bioavailability than CBD, which is a fairly known characteristic of CBDA. In beagle dogs, oral administration of CBDA at 1 milligram per kilogram was well tolerated and was 2-fold more bioavailable than CBD. Although no data on the bioavailability of CBGA are yet available, the data for CBDA does suggest that concentrations for CBGA should also be possible. Researchers concluded this article by stating, with widespread use of cannabinoids, resistant variants could still arise, but the combination of vaccination and CBDA or CBGA treatment should create a more challenging environment with which the SARS virus must contend, reducing the likelihood of escape. Likewise to the CBDA-CBG data, the published research on CBD and COVID included very preliminary results. There were studies that were compared in the research. There were 3 studies that were compared in the research, which were human data that was observational, the virus in human lung epithelial cells, and with mouse models. The observational human data looked at test results of 1,200 individuals who were taking the FDA-approved CBD Epidiolex to treat seizure disorders. On average, those who tested negative on a COVID test were taking 1,500 milligrams of CBD per day. Researchers reported that the 531 who tested negative were likely taking CBD at the same time of the test. Being an observational test rather than a controlled environment, such assumptions did have to be made. They also stated that those who tested negative likely had reduced mobility with restricted public interactions, as well as were intentionally limiting public interaction for fear of exposure. In other words, they were being more conscious because they knew they were immunocompromised, so probably were not as likely to be out in public. The data found with the human epithelial cells showed that CBD may have inhibited the virus from replication after 48 hours of infection. Researchers state that CBD could be acting by blocking viral entry to host cells or at later steps following infection. And then with the mouse studies, the third study, data showed similar findings to the cells. Mice were injected twice daily with CBD at 20 or 80 milligrams per kilogram. It's a little bit higher than the last study for 7 days prior to COVID infection, and continued CBD administration 4 days after infection. Again, these results established preclinical efficacy of CBD as an antiviral drug for SARS during the early stages of infection. So while this data doesn't hurt, and it's great to see the power of plants being researched in this way, it is really much too early to confirm that CBD or CBDA or CBGA could prevent or treat this specific virus. However, when it comes to viruses that may weaken our immune system, we can point to the antioxidant effects of specific cannabinoids that may provide our immune systems with a bit of a boost. And this is something that I'll cover in a little bit more detail when we get to the disease state discussion. So, moving to talk a little bit about cannabis and cancer, there is a large body of data with solid scientific evidence that points to the role of the endocannabinoid system, our ECS, in tumor generation and progression. The introduction of cannabinoids to the ECS has resulted in the inhibition of tumor growth, as well as suppression of malignant cell growth and cancer cell death. The combination has shown promising efficacy against glioma and other tumor and cancer types. The anti-tumor activity of cannabinoids has been well researched with several cancer types for decades now. One of the first studies completed to describe the anti-neoplastic, or the action of preventing, inhibiting, or halting the development of a tumor, was actually published in 1975. Here it was demonstrated that the administration of delta 9 THC, delta 8 THC, and CBN inhibited the growth of Lewis lung adenocarcinoma cell growth in vitro, which is outside the living organism, and in vivo, which is within a living organism. In this case, it was oral administration to mice. So since then, we have seen through research cannabinoids having an anti-proliferative, meaning inhibiting tumor cell growth, anti-metastatic, or inhibiting forming a secondary tumor, anti-angiogenic, reduction of blood vessels, and pro-apoptosis, or cancer cell suicide effects across various cancer types to include lung, glioma, thyroid, lymphoma, skin, pancreas, uterus, breast, and prostate carcinomas using both in vivo and in vitro models. Since then, we have seen through research cannabinoids having an anti-proliferative, recently more phytocannabinoids are being researched for like benefits. The ability of these cannabinoids to modulate cell survival and death as it relates to tumor and cancer growth has been considered as significant from a drug development perspective. For a few examples of that recent significance in specific cancers, what has been seen is first, recently data gathered in 2015 for the American Association for Cancer Research studied the effects of CBD, delta 9 THC, CBN, and CBG on proliferation of breast cancer cells. Among the tested, CBD was actually the most potent inhibitor of breast cancer cell aggressiveness. And then when it comes to the anti-cancer activity of CBDA, it was investigated on acute lymphocytic leukemia cells, and human prostate carcinoma receptor cells, and it was found to be less active than CBD for all of those until it was tested for MDA-MB231 cells, which is a highly aggressive triple-negative breast cancer. And CBDA was actually found to inhibit breast cancer cell migration. So they are doing more research into specific cancers and how different cannabinoids can affect those specific cancers, which is really great to see in our research. So the cannabinoids that have been used to study these effects, they also show the ability to decrease the negative side effects of conventional cancer treatments and therapies, as well as having an acceptable safety profile. One feature of cannabinoid anti-tumor action in several types, which is pretty novel, is that there is no toxicity observed in non-tumor cells. With this and other observations, cannabinoids have adopted the reputation as having safe profiles. In fact, they have proven safe in thousands of individuals among many, many clinical trials in cancer patients while they were observing the management of pain, nausea, and vomiting. And then to speak to those side effects, THC has been recognized for its antiemetic and appetite stimulating effects, but recently CBDA has also been recognized to be antiemetic as well as potential for anticipatory nausea, which is something that someone who goes through chemotherapy may experience often. It is also believed that cannabinoids are safe to take in conjunction with traditional cancer therapies, but talking with a doctor is always suggested. However, research does suggest that cannabinoids may actually increase the effectiveness of chemotherapy and radiation treatments. When we're talking about cannabis and diseases, many diseases have been hypothesized to link back to oxidative stress, such as diabetes, neurological diseases, cardiovascular diseases, and even some cancers. And so, just in case anyone's unfamiliar, oxidative stress plays an important role in the degeneration of dopaminergic neurons, for example, in Parkinson's disease. Oxidative stress takes place when potentially harmful free radicals, which are atoms that may cause damage to cells, proteins, and DNA, overwhelm our body's natural antioxidants. So, when we take in endogenous antioxidants to assist our body in the prevention, um, we can help to prevent or decrease oxidative stress from taking place. The antioxidants we take in safely interact with the free radicals before molecules can become damaged. Endogenous antioxidants you may be familiar with are vitamin E, vitamin C, beta carotene, zinc, which many of us will take as fruits or vegetables or as supplements. So research has actually shown that the ability of CBD and THC that they're equally successful at blocking or modulating toxic levels of glutamate. So glutamate is an excitatory neurotransmitter that is released by nerve cells in the brain and responsible for sending signals, which plays an important role in our learning and our memory. However, it can also be damaging to nerve cells and the brain as a whole when there are abnormally high concentrations of glutamate or when the receptors are overly sensitive, meaning that less glutamate is needed to excite the cell. Then the cells, what happens, they become overexcited, which leads to their damage or their death, or in other words, oxidative stress. So the effects of CBD and THC on glutamate, these toxic glutamate levels, when tested, were comparable to the industrial antioxidant known as BHT, suggesting their role as effective antioxidants. In addition to the antioxidant benefits, cannabinoids may also have neuroprotective benefits in that they may increase the density of our CB2 receptors, mainly found in microglia cells. So microglia cells are known as the immune cells of the central nervous system. They play important roles in brain infections and inflammation. CB2 receptors have become interesting targets for the treatment of neurological diseases as their activation has been related to a delayed progression of neurodegenerative events. Research has shown that in resting healthy brains, microglia move constantly to survey the brain. Activation of CB2 receptors and likewise active microglia may rapidly respond to pathological insults that may lead to disease progression by providing neuronal protection. In a study with cannabis users, bradykinesia was the most common symptom that was alleviated among cannabis users, followed by muscle rigidity and tremor. Bradykinesia is the reduction of automatic movements, difficulty initiating movements, decrease in expression, and overall slowness of movement in those suffering with diseases like Parkinson's. As far as studies in the humans go for the effect of cannabinoids on motor functions, it's mostly observational. But those who have participated have reported a calming effect for their muscles with the use of cannabis, therefore lessening tremors, which is especially prevalent in the first two stages of Parkinson's. A study published in 2008 sought to demonstrate the management of psychosis and Parkinson's disease by evaluating the efficacy, tolerability, and safety of CBD on individuals with Parkinson's. The psychotic symptoms evaluated by the brief psychiatric rating scale and the Parkinson's psychosis questionnaire showed a significant decrease under CBD treatment. CBD also decreased motor functions and did not cause any adverse effects across the population. The data from the study suggested that CBD may be effective, safe, and well tolerated for alleviating psychosis in Parkinson's. When it comes to autoimmune inflammatory diseases such as rheumatoid arthritis, cannabinoids have been considered for relief due to their pain relieving and potent anti inflammatory properties. Cannabinoids are commonly investigated as pain relieving agents, but in recent years, more evidence has accumulated on their potential immunomodulatory effects, supported by results in animal models of certain rheumatic diseases. While results that demonstrate the same effect in humans are lacking, cannabinoids and cannabis remain potential options to alleviate the pain associated with rheumatic diseases, as they were shown to be safe, once again, and to cause limited adverse effects, if any. It has also been suggested that cannabinoids have an anti-inflammatory modulating quality that could exert a therapeutic effect in such conditions, as cannabinoids were shown to have an overall anti-inflammatory effect on immune cells. These results were reinforced by studies in animal models of rheumatoid arthritis and systemic sclerosis. So we know through research that CBD has a wide spectrum of biological activity, including anti-inflammatory activity. This is why its activity in the prevention and treatment of diseases whose development is associated with inflammation has been and is being tested. Based on current research results, the potential to utilize CBD for the treatment of diabetes, arthritis, as well as cardiovascular diseases, cancers, epilepsy, neurodegenerative diseases, IBS, IBD, Crohn's, and skin disease is being considered. Clinical studies have confirmed that CBD reduces levels of pro-inflammatory cytokines, inhibits T cell proliferation, induces T cell apoptosis, and reduces migration and adhesion of immune cells, all important for anti-inflammatory action. The ability of CBD to also alleviate symptoms of mood disorders, being anxiety, depression, and in some cases psychosis, also contributes to the lessening inflammation of the mentioned diseases. The anti-inflammatory contributions of THC are also extensively studied, showing PGE2 synthesis, decreased platelet aggregation, and stimulation of lipoxygenase, all actions related to reduction of inflammation. When studied, THC had 20 times the anti-inflammatory potency of aspirin and twice that of hydrocortisone. Minor cannabinoids in the cannabis plant may also contribute to the anti-inflammatory activity, such as THCA, CBDA, CBN, CBC, and CBG, just to name a few. CBC was studied with mice, and it showed that it helped to increase intestinal motility by lessening intestinal inflammation. Animal studies have also shown CBG to reduce the effects of inflammatory-related conditions such as inflammatory bowel disease. CBG has also been shown to have potent analgesic or pain-relieving qualities as well. And the terpenes in cannabis additionally show analgesic and anti-inflammatory attributes. Myrcene is analgesic, for one, and blocks inflammation. Another, sesquiterpene B-caryophyllene, also shows promising anti-inflammatory and analgesic properties. And then of other anti-inflammatory terpenes, borneol, nerolidol, linalool, limonene, and pinene are among the most popular. And then for flavonoids, canflavins A, B, and C are among some of those with researched anti-inflammatory actions as well. So while there is a lot of promising information, what must be noticed is that most studies investigating the therapeutic potential of cannabinoids, especially when considering THC and minor cannabinoids due to federal restrictions, have been conducted in animal models with a limited number of clinical trials carried out. This is why it is important to help move research forward to support those who suffer as well as the medical community, so that way we may continue to legitimize this form of therapy. And then I know our information is here, but I just wanted to make sure I put it in here as well. If for finding support and recommendations for cannabinoid therapy in specific conditions, it can be difficult, but that is where Realm of Caring may step in to help. Our care specialists are trained to help with product and practical administration suggestions, whether you be an experienced user, a novice, or just calling to support a loved one. So, in general, cannabis is safe, but responsible use and guidance, as well as an oversight by a healthcare professional when possible, are always recommended. And we're here to help start and facilitate those conversations along the way. So, please stay in touch if you have any questions.